If you're like most folks Dr. Kris works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life Podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris Podcast. Welcome back, everybody. Dr. Kris is in the house. Dr. Kris Fusterhausen of the Research Clinic. How are you, Dr. Kris?
Very good today. Very good.
I enjoy these conversations because, there's just a group of us. We're not meatheads. We're not super health freaks. We don't run a bunch of marathons, and yet we do want to take control of our health. And it's like your voice is becoming our voice. You're helping us figure out all these little things that as we age, we deal with and they bother us. But if some of us don't know, there are things to do. And so it's nice to hear from you every week, Dr. Kris.
Well, thank you. I appreciate that. That's very nice. Very kind of you to say.
So peptides and age management, there's all these things going on. And we've been in this COVID stage. And I kind of joke that I got the COVID-15, not the COVID-19, but it's like the freshman 15. And where I literally gained 15 pounds because I was sitting around the house more. I was stress eating, I guess. And it's been a bit of a battle to try to let go of that. I'm sure I'm not the only one. Dr. Kris, tell us about it.
Yeah, I was at a function the other day, and one of the ladies, she's really funny, and she said that she had gotten COVID-19. I said, "Oh, really? How'd you do?" And she goes, "Well, I got it right here." And she was talking about she really hadn't gained 19 pounds, but it's exactly like you say. I was having this discussion this morning with a new patient, and I think the vast majority of us have changed a lot of our lifestyles because of the pandemic. Just our normal being out and being active and doing things and going into a department store and walking around. Those are burning calories. Those are making differences. And in some ways you think we would have done better because if we're not going out to eat and those things, that we would be at home, we would be eating healthier. But I always kind of think that you're either all in on the health mode or you're kind of all out. And when we're in a pandemic and none of us were very happy about the situation, I think a lot of us made less than stellar choices with our diet. And also, even though we probably could have used that time to increase our exercise at home, I think most of us went the other direction and decreased it. And I'm speaking for myself when I did that. And I think that I'm speaking for those out there that may be listening, that the majority of us did the same thing during this pandemic.
Yeah, sometimes when you're under stress, you check out and revert back to the old ways. And I wanted to remind everybody that these conversations are intended as educational and that whatever we discuss today, that you should always consult your physician before changing your medical program. So some of the things that I guess that we deal with is how to start getting back, taking positive action, losing a little weight. What are some of the things that maybe we could consider, Dr. Kris?
Well, I think the first thing, and it's a little bit off the path, but is making sure you've been vaccinated. I think that's a great place to start for everybody out there. I know it's still a little bit of a hot topic. Hopefully it's becoming not quite as hot as it was now that the vaccine's been out a little bit longer, and we're seeing that no one's dying from the vaccine, and that the studies are really showing that once you're vaccinated, your chance of getting a severe case of COVID is really, really low. So the first thing before we kind of institute these other things I would recommend is, now that in Texas, anyone 16 and older can get the vaccine, no matter what symptoms or conditions that you have, is I would just encourage everyone to go get vaccinated. Just get it over with, get it done. It's going to allow you to travel safer, go out into the public safer. CD says that people who are vaccinated can actually get together. And so I just think it's an important thing not to forget about. And the other thing that I would really like to kind of mention before we kind of go into this is so many of the patients or people even listening to us, I'm sure, have had COVID-19, actually have had it, not the weight gain necessarily, but actually had the disease of COVID. And, the studies that are coming out now are becoming more and more apparent that many of the people who had symptomatic COVID are struggling with post-COVID syndrome in some form or fashion. And I've actually seen some studies that say that if you were actually hospitalized, that you have about a 60 to 70% chance of having symptoms for months post-COVID, whether that be fatigue, depression, difficulty breathing, shortness of breath, a multitude of different symptoms. And even if you weren't an inpatient hospitalized, you're still seeing about a 30 to 40% chance of having some form of symptoms for weeks and months past COVID. So the first thing I would just say is, if you're out there, if you feel like you fit that category, is really talking with your provider, making sure that y'all have a good plan of how to kind of get out of that post-COVID syndrome. And we're learning about it as time goes. We haven't got it all figured out, but there are some things that your provider can do for you, in my opinion, for that post-COVID syndrome. I think a lot of patients are just kind of dealing with it, and I think they'd be better off if they were actually talking to their physician about it.
Yeah, the post-COVID funk, there's the emotional side.
Uh-huh.
I was just kind of joking the other day, but because I spend a lot more time by myself, I've been doing these from home. I feel a little socially awkward,
Right. Yeah.
So
I think all of us do that a little bit. We actually went to like I said, that get together the other night, and we realized it was the first time in over a year that we actually went to somewhat of a normal event, and it felt very awkward for the first couple hours. Like, how do we interact here? This is very different. So it's kind of nice though that we're finally starting to enter back into some realm of normalcy.
So there are some things, again, I keep seeing a lot of things about vitamin D floating around, and how vitamin D it's more of a hormone than a vitamin D, that there are just these other news stories I'm getting about some vitamins and stuff. So talk to us a little bit about what you think.
Yeah, so it's funny you say that. I always tell my patients that I wish it was hormone D, but it's not. It's vitamin D. And I try to really hammer on my patients how important vitamin D is to our overall health. The vast majority of people out there have suboptimal vitamin or even low vitamin D levels. We get vitamin D from sun through our skin, and we get some from our diet, but we're truly just too far from the equator. We know too well to not get too much sun so that we don't look 60 when we're 40 and get a lot of skin cancer. So it's so easily replaced, and that's what I try to tell my patients is it's actually something that we can fix with a simple capsule every day, and it's not expensive. The problem is a lot of patients just don't take enough vitamin D. I find that some providers are actually very conservative with vitamin D, but it is important that your provider is actually not only replacing it with you, but also doing follow-up labs to make sure those numbers are where they need to be. Because the vitamin D levels, of course, play a crucial role in our musculoskeletal system, but also our immune system is tied to our vitamin D levels. There's a plethora of studies out there showing poor COVID outcomes associated with low vitamin D levels, and then also our mood. There is something to getting sunlight every day. You were kind of talking about how you're by yourself, and you can kind of notice you're in the house, you're doing all these things. We just feel better when we go out and get a little bit of sun. Of course, I always say, as the aesthetic side of me, I don't want you getting too much sun, because I also don't want you getting aged by the sun. So we can kind of accomplish that with the vitamin D. One of my patients this week had a great question that she asked me, and I hadn't actually thought of this until she asked it. And she goes, "I'm vaccinated, and I've had COVID, and now I'm vaccinated. should I still continue all this stuff or can I stop it now? And I said, well, really and truly, we should be doing this all the time. We just got our pants scared off of us by or some people by COVID. And so we started actually taking our D and our C and our zinc. But these aren't bad things that we should be doing all the time, because as we leave the pandemic, then we're going to actually come back to our normal diseases and, flus and different viruses. And so as you and I always talk about, we should always be working towards trying to modulate our immune system as best we can. So vitamin D is very, very important. And in my patients, I usually recommend between 5,000 to 10,000 units, international units a day, whereas so many people take 1,000 units, maybe 2,000 international units. It's just not enough for most patients. Really hard to take too much vitamin D. And so I just think that talking with your providers about that is very important. But as we're, the timing of all this is perfect. It's spring. The weather is turning to good. We can get outside. It's not too hot. It's not too cold. And so when patients are trying to figure out, how do I start getting some of this weight off? How do I start kind of getting out of this funk? The first thing it starts is just trying to get active again. The biggest thing with exercise is doing something that you actually like. If you don't like it, you won't stick with it. I promise. So you have to find some form of exercise that you somewhat enjoy, like a guy who loves to cycle, then great, get after it. That's great. I personally, I can't stand it. So, I tried it. I went and bought a bike and spent like $2,000. And I think I went twice and this makes my butt hurt. I ain't doing this. And so I couldn't walk for a week after that. I was like, no, this isn't for me. So finding what you like to do, but really and truly, actually getting the weight off all goes back to what we always talk about is nutrition. As one of my weight loss consultations this morning was about, she's an active exerciser, but she was having some difficulty losing weight. And as I said, it's all about your nutrition to lose weight. Exercise, not much of an effect. Some, but not much on actually losing fat cells. That goes all the way back to all those tricks that we've talked about in the past on these podcasts. If you actually want to get the weight loss going. So it's just a perfect time and we can start breaking it down if you want to, but it's a perfect time to kind of get back out there, get reacclimated. Maybe there is that actual trip that's going to occur this summer that you didn't get to do last year. We didn't have really a swimsuit season last year. And I always find that even the men, heck, I know if I'm going to go to Mexico and have to take my shirt off, I'm going to do a little bit better, versus if I'm not going to have to do that. And I think that's the mode a lot of us were in last year.
So I started looking for an excuse to get out and do a little more exercise now that it's warming up, get some sun. So I've been walking my dog, but it's like the last couple of days I felt a little bit foggy and groggy, and I wondered what's wrong with me. And I realized that maybe I'm having a little bit of allergies. I normally don't have this, but I notice like the back of my throat's real dry, and I'm sneezing a little bit more. So that's going to be in play as people get out and get more active.
Sure.
Yeah. What do you have to share with us?
Well, so one thing I like to try to tell patients, if you start to notice that you have what you believe to be allergies, is get one of the really cool apps that they're out there. You can actually just go to your app store and put in allergies, and there'll be a plethora of different apps. And when you're feeling like that, actually look, because you tag it to your location and see what's blooming, what's high. And as time goes on, and as you start to look at that over and over, when you have that scratchy throat, little congestion, maybe some sneezing and runny nose, you might start to notice a trend like, oh, wow, every time I look at this, it's, mountain cedars high or whatever. You certainly can go to the allergist and get the fancy testing, but many times we can figure this out on our own just by watching these apps and seeing what's going on. Like, I know I'm mountain cedar and cottonwood. If I would be smart enough to actually just start my Zyrtec prior to when it starts to go up, but I'm hard-headed, I wait for the symptoms to occur. Not the way we're supposed to do it, but I'm a hard-headed physician like a lot of other just people out there, hard-headed, that is. And so, but really and truly, I think it's just realizing that there are other things that exist in our atmosphere. It's not just COVID, that we can and just have good old allergies. As one of my patients, I think, sarcastically said, all the other illnesses have not disappeared. They're still there. And so this is, spring is the most common time for allergies start to flare. We are in the Panhandle where you're at, and in North Texas is the highest allergen capital in the country. Wow. So a lot of people don't understand that. We deal with that a lot around our area because I saw something the other day, or actually listened to it on the radio. They said over 60 to 70,000 Californians are relocating to the Metroplex per quarter right now. And so these poor Californians, they come to Texas and they've never been exposed to the stuff that we have in Texas. And then we see them in our clinic and they're like, I'm dying. And it's like, welcome to Texas. So, it's just a matter of dealing with those things. The good news now with allergies is that so many of the things are over the counter. All those prescriptions that I used to have to write for patients, your Claritin, your Zyrtec, your Allegra, they're over the counter. Your Flonase and Nasonex nasal sprays, over the counter. So, really and truly, most of the stuff besides steroids and some specialty nasal sprays are over the counter these days.
So one of the things that I've been doing since you and I started talking, it's been about 6 months, I started doing intermittent fasting more regularly. So I've developed a habit and it's a lot easier now. And the weight is coming off slowly, but it's something that takes time to do. And I just really want to tell you that I think that it's made me have more energy. I've lost weight. It's just gotten easier, and it's not that big a deal, but it makes a big difference.
It's a huge difference. And in my opinion, unless you're an insulin using diabetic or maybe just a diabetic, that would be something that I would have to talk through it with my patient. Other than that, I can't come up with a good scenario why someone cannot intermittent fast. They might think they can't, but that's just getting through that barrier. Mm-hmm. To me, it's like when patients come and they say, I want to lose weight. And I say, okay, do you drink soda? Yes. Well, you got to cut that out. Well, I can't cut out soda. Well, then you can't lose weight. That's kind of the way I've become with intermittent fasting. Like, okay, I'm not willing to intermittent fast. Well, I don't know that I can fully help you because it's such a tremendous biohack to the metabolic system in order to get you lose weight. I try to explain to patients that this is the way I truly believe that we were meant to eat. When we were first on this earth, we didn't have food. We could not go to HEB and buy meals and eat 5 or 6 times a day. It's just not the way I think that we're meant to do this. And so by going 16, 18, sometimes 24 hours without eating, we're resetting that system. We're detoxifying the body. We're increasing autophagy and energy and brain function, but we're also making our body use the fatty acids for fuel so that we're burning those fat cells. As you and I've talked about, it costs nothing. So, that's one of those things that very rarely can I recommend something to my patients that costs them nothing. Actually, you might say it saves you money because you're not eating a meal a day. So it's just really hard. Luckily, my patients, after I talk to them, kind of like I just did, seem to be on board with it. But I hear it over and over whenever they give it a month and they come back in a month and they're like, it kind of sucked that first week. I thought you were crazy. I didn't think this was going to work. The second week, it got to be not so bad. And then like after 2 weeks, I felt great and everything's been good since. And man, you've got me to be a believer. And then you see them 2 or 3 months down the road and like, man, I've lost 5 or 6 pounds and I've done nothing else different in my life. And so it's certainly not the answer to everything, but it sure is a big piece of the solution for my patients. So it literally, I would say if patients got nothing else out of today's talk is to try intermittent fasting. And again, what is the definition of intermittent fasting is most of us use the 16-8 model. So 16 hours a day, continuous. Yes, that counts when we're sleeping, that we're not consuming any form of calories, that we can consume black coffee, water, or unsweet tea. And I try to get my patients to do that at least 4 or 5 times a week. I personally like Monday through Friday, off Saturday, Sunday. You could do 7 days a week if you chose. And then as you get good with that, and you get comfortable with it and you feel like you're kind of ready to move on to the next phase of fasting, you could then try to mix in those one meal a day, maybe every now and then, every couple of weeks, once a week, something of that nature. They call that OMAD, one meal a day. Some of my patients do that all the time. I don't know that I'm a big fan of doing OMAD every day. I think that the more you can keep your body guessing, the better off you are. And so I think that if Steve does a 16-hour fast today and tomorrow does an 18-hour and the next day does a 17-hour, next day does a 23-hour, I think that's where you're going to see your most benefit. But you're going to see a benefit just by doing the 16-8. Simple. Some people never move past it. That's fine. You don't have to really do that. As you and I've talked about it, I met a patient today that did a 72-hour fast, and he was just ecstatic about the effects of it. I'm like, whoo, man, I don't know if I'm ready for that. But, that's somebody that's just fully bought into fasting and the effects that it has on the body in a good way, that is.
Well, the other flip side of that is the feasting. When you cycle these things, when you're not doing it every day, the same thing over and over, then it means that your body's having to adapt and adjust, and it's very healthy. And so the feasting side is just as fun.
Yeah. And especially like when I do one meal a day, I save that for like maybe every 2 weeks or so. I do and I usually do it on a Friday. And then my reward back to myself is I can kind of have nearly whatever I want for that one meal. And the great news is I come out of that without gaining any weight. Typically I lose a little bit of weight, even though I had this meal that maybe normally I wouldn't have had. So it's kind of my reward to myself. You certainly, if you did not want to do that, that'd be okay too. But you're getting that extra boost of metabolic burn by doing that one meal a day. So, I think all of us out there remember like P90X, the workouts and how successful that they could be for some people. And why was P90X really successful? It's all about what we just said. It's about a completely different workout every day. It's keeping the body guessing. And that is true. The more we can keep our body guessing, the better off we are. And as we enter that gym again, I always like to use the example of we of course have our own gym that we have here at our facility now, but back in the day I would go to a local gym and I would go at a particular time every day, and I always see these 4 or 5 people doing the same exact workout every time I stepped foot in that gym. And I always felt so bad for them, but I didn't know them. I didn't want to embarrass them and go like, dude, this is wrong. But I saw them over years, like 2 or 3 years, never changing, and never losing any weight, nothing ever happening, because they'd get on the treadmill, they'd put in the same number with the same incline for the same amount of time. And that's just the one basic piece of advice I would give to a patient. You cannot do the same exercise over and over and over and expect it to do anything. Even if it's walking, you can't walk at the same speed for the same distance. You're just not going to see results that way. But nutrition is that way. I think that it's a good idea if you're really dedicated to switch up your diets from time to time. Like we said, switch up the fasting times. Just keep that body guessing as you get better and better with fasting.
So we're talking about gaining weight over the COVID season, and it's not one silver bullet that you can do to make this improve. And so you have to do a holistic process. You have to change your diet. You have to consider what vitamins you're taking and also how you're fasting or exercising. But some of us, Dr. Kris, we need a little help melting some of that fat that's accumulated over the past 50 years or whatever. At the clinic, you actually have some things that can help us get past those little stubborn humps.
Yes, I always tell patients, a lot of patients have heard of the term like CoolSculpting. That's something that I believe that you may have no idea what it really is, but you've heard CoolSculpting. They've spent a ton of money on CoolSculpting is actually owned by Allergan. They've spent a ton of money on like a NASCAR team and a pro golfer, and the Kardashians have promoted it. And that's kind of the little bit older technology. And I was exposed to that many times and considered adding it to my practice multiple times, but I always had a little bit of hesitation with CoolSculpting. And then luckily I was exposed to Warm Sculpting or Sculpture. Those kind of names are synonymous. Their new kind of tagline is Warm Sculpting. And I was intrigued by it because it was a newer technology than CoolSculpting, and it basically, we lost all the what I deem to be not so good stuff with CoolSculpting. So Warm Sculpting is an FDA approved device for basically melting or lysing fat cells, and FDA studies show that you get up to 24% permanent fat cell reduction per treatment. So when you compare it to CoolSculpting gets the exact same FDA clearance, which is up to 24% permanent fat cell reduction per treatment. So you can compare CoolSculpting and Warm Sculpting and say they're equivalent as far as the success rates. The differences really are that Warm Sculpting is about half the time of CoolSculpting. Warm Sculpting is a lot less uncomfortable than CoolSculpting. Warm Sculpting is operator independent, whereas CoolSculpting is operator dependent. So in other words, how good your operator is can determine how good your results are. And sometimes you can actually get some pigment changes with CoolSculpting and some temporary to permanent neuropathy after CoolSculpting. So I always like to tell patients Warm Sculpting, in my opinion, is basically CoolSculpting that's shorter and without all the bad stuff. And also, of course, it's a warm process versus a cool process. So Warm Sculpting is indicated. So it's the one thing I do. The one thing that is I like my patients to understand, though, it's not for the patient that needs to lose 20 pounds. Okay. This is for the guy or girl who is got problem areas and despite nutrition and exercise, can't get those spots to get to where they want them to be. Most common is love handles, thighs, bra bulge. Those are some of the most common areas, upper abdomen, lower abdomen that we treat. So they come in, they get a consultation. If we believe they're a good candidate, in other words, we believe that Warm Sculpting is for them. We then set them up for a procedure. Each procedure is 25 to 50 minutes, depending on how many areas we're treating. And we typically will do a treatment every 4 to 6 weeks. And it typically does take about 12 weeks from the first treatment to see the results. And then a lot of patients, of course, how many treatments do I need? Well, that, of course, depends on the person. Most people need 2 to 3 treatments. And we also have a new attachment. We can treat the submental area. So that chin area, we can actually treat that now as well. That's a new addition to our practice in the last year.
So that's a chickens. What do you call that?
The gobbler.
Yeah.
Yeah.
So
it's a common problem. I know mine's gotten a lot better after treatments, but it's something that we start to get even when we're not really overweight. That little area, we like to put a little fat there.
When you were showing me around the office, it looks like those Batman utility belts that you put around you, right? Yep. And I looked at it and it's like, it looks like it would be painful, or it's like it's going to be super hot. What's the reality, though?
So the reality is there's different levels of warmth, and the technology is amazing. It was actually developed by MIT, and And I am probably the biggest wuss in the practice when it comes to this type of technology. I don't know why, but temperature really bothers me. Needles do not. You can stick me with needles and I won't really complain too much about it, but heat does. I blame it on being a redhead when I was a little kid. I say that's why it is. It's maybe I'm just a wuss. Who knows? The ladies, if they're out there listening, will go with the latter, not the former on that one. But what it actually does, it's a cycling heat with cold. And so you'll notice that it actually starts and it kind of builds. And it's funny. When it starts to get really warm and to the point to where you think, I can't take this, the machine immediately switches to cold for about 10 seconds. And as soon as it goes to cold, it's completely pain-free. And then that cycles for a few seconds and then back to heat. And then the ladies, without you even knowing it, they're watching you and seeing how you're doing through this process. They're actually turning up the heat heat as they go through it, because you do get a little bit better results if you can, the warmer that you can go. And so most of the time, without you even realizing it, they go ahead and take it up to the max temperature. You don't realize it because after you get into it for about 10 minutes or so, you don't know these little temperature changes. We help the patients through it by putting fans on them. Just the cooler you can keep the body, it's not going to affect where the actual electrodes are, but you'll break out a little sweat from the heat. And if you can keep that cool air blowing on you, it's not that bad. Honestly, I think I'm the one that takes it the worst. Women do this procedure so much better than men. And so, but my girls are really good at coaching them through it. And for most patients, it's only 25 minutes. And so it's really quick and it's over, but much, much less intense than the CoolSculpting procedure.
So it's melting the fat and just absorbs back into your body? What's happening?
Yeah, so the heat basically, and the way it's penetrating, it's actually causing those fat cells to rupture, or in medical terms, lyse. And so it's permanently rupturing those fat cells. That will then flush through your lymphatic system and go through your urinary system and out. And it's been proven to be safe. Like I said, this is a fully FDA approved device. Lord knows we talk about the FDA enough, but this one's a fully FDA approved device. And it really works in the right clients. But what you can't do, and this is where I've started because I own the machine, that I struggled in the beginning, is I would use this machine and kind of use it as a hack, not as a tool. And I would, okay, I gained 2 pounds around the waistline. Let me go melt it off. And that's not the way we want any of our patients to look at this machine. We want you to look at it because let's be honest, a lot of us, even though we exercise right, we eat pretty decently, we take our hormones, we take our vitamins, we use our peptides, we still got some areas that are pretty tough. Unless you're really dedicated. If you're in that gym 2 hours a week, 5 days, 2 hours a day, 5 days a week, eating really clean all the time, but who's got time to do all of that perfectly? Mm-hmm. I don't. And so it's just a really nice addition for those patients. We just have to try to educate our patients. It's not for whenever you have 20 pounds on you. That's just not I'd rather you take that money that maybe you're going to spend on this and spend it on a trainer. And that's what I'll tell patients. Hey, instead of spending some money on this, use that money to spend on a trainer for a few months, and you're going to get further down the road, and then come back in 6 months, and then we'll do this. And so luckily the patients take that well whenever they come in, but because unfortunately you can't always screen the people until they come in, and you get them in, it's like, oh, this poor person, this isn't going to be for them. But for those patients with that, I just call it the problem areas. I'm not really necessarily overweight or fat. I'm not obese. I just got these areas that I just can't get rid of it. It's perfect for that.
Does it work on man boobs?
Yeah. So yes, it can. We've actually treated a few guys with gynecomastia, or just anywhere that there's fat and we can apply the electrodes to properly, you can do. That's why we couldn't used to do it under the chin because we didn't have a way to apply it, but they finally figured out the harness and how to. You look awfully funny when you're doing it, but we wouldn't want to put you on Facebook while you're doing it. But yes, you actually can do that. That's quite similar to the bra bulges. We just move it around instead of back there. So yeah, you can. Absolutely.
So this would be a very complimentary process where maybe you've been intermittent fasting some, you're trying to eat a little bit better, you're maybe taking some peptides. What peptides would generally be associated with this if you were doing a holistic way to approach this?
Yeah, so you covered a bunch of it. We also don't want to forget about our ketone esters with our intermittent fasting. That's going to really help in a roundabout way to improve our athletic performance, giving our cells the proper fuel they need to do their function, to just work better, function better. So I'd throw that in there as well. As far as we also want to make sure that our hormones are balanced, and I never want to forget about that. I still feel like that's kind of the meat and potatoes of all this is nutrition, exercise, and hormones, making sure that those are accurate, and just making sure if you're a listener that, you have someone managing your hormones and hopefully doing it properly. And then after that, then that's when the next step would be peptides. After we've gotten our ketone esters and our supplements and we're eating pretty good and we're intermittent fasting and we're exercising what we believe to be a good level, then the next step would be some peptides, possibly for the patients. And again, I'm always going to go back for weight loss. I'm always going to go to the growth hormone secretagogues or the GHRH, GHRP combinations. I like that for the metabolic effect that you're going to have on the body, for healing, for improved sleep. So, the most common one that a lot of people have heard me talk about is the CJ Ciepamorelin. That's just a great combination if you're a good candidate after you've been screened by your provider for adding on to all those things that we've already been talking about to really boost that fat burning and muscle gain to get those benefits that we've just talked about.
Yeah, I've been taking the ketone esters myself, and I was concerned about taking them too late afternoon that it would keep me awake. Mm-hmm. But when I listened to Frank talk about them, how they're not giving you energy in that way that we would think, like caffeine or something. I've been taking a capful before I go to bed. I think I'm sleeping way better.
Yeah, and all I tell patients with that is just don't take too much. Mm-hmm. They actually recommend 2 to 5 cc's. A cap is 5 cc's. So 2 to 5 cc's before bed can help you sleep better. Anything more than that might keep you awake, but not because of like caffeine effects, because as we know, it has no caffeine in it. Mm-hmm. Just, you're putting all this fuel into the body, and if you put too much, you're just energized and you don't need the rest at that moment, but unfortunately you will the next day. So you just have to kind of be careful with that. Maybe start with a little bit after supper, see how you do. If you do okay, you could kind of inch it towards bedtime. But ketones esters are awesome. And they have the new snake water out as well, which we've really started using a lot personally. Crisanta and I am really liking the snake water, which is the ketone esters with electrolytes with some natural caffeine in it. And we really like that one as well for kind of that. I've started kind of using the KE4 alone in the mornings and a little bit of snake water mid-afternoon. I think that's a really good way to go. A little bit more costly. So, certainly not something someone has to do, but we're just kind of experimenting still with the snake water, getting used to it.
So at the research clinic, if I wanted to take advantage of this warm sculpting, what does it look like? I'm going to come in and set a time. I'm going to get an assessment, and then what?
Yeah, so you're just going to simply come in. You're going to talk to us. You're going to tell us what you're looking for. We're going to look at you. We're going to take some pictures specific to the area that we're wanting to treat that stay with us and nowhere else. We're going to do some measurements, and we're going to decide if you're a good candidate together. After educating the patient and looking at the patient, if we believe they're a good candidate, and after we explain what we want to do with them, if they believe, if they feel good about what information we've given them, then we simply typically we actually can do the procedure that same day. We typically block the machine so that if someone comes in and is ready to go, that we just simply boom right over to the treatment. They would come back usually 2 to 3 times a month apart. And then we would bring them back 2 to 3 months after their last treatment for kind of those follow-up pictures and measurements and see how they're doing at that point. Pretty easy procedure. Like I said, 25 minutes per cycle. Like my personal treatments are 50 minutes, but that's because I'm treating 2 different major areas, and we can only treat one major area at a time. So 25 minutes for one area, 25 minutes for the other area. But still really, really easy. We have them in and out in 30, 40 minutes to an hour, depending on how much we're doing. And it's pretty much that simple, really.
Sometimes when you lose weight, you're a little saggy, or what's the outcome here? Does this prevent that sagging, or is it?
So the only time I would really say sagging is if someone already has skin stretching.
Mhm.
So like if someone was really overweight at some point, maybe they had bypass surgery or they just changed their whole life and they lose 100 pounds. That person probably wouldn't be a good candidate for CoolSculpting. So even though they're weight-wise a good candidate, we still, as long as a person still has good elasticity to their skin, the sculpture itself is going to give us some of that effect of tightening of the skin. We sometimes will even combine that with a radio frequency based device, our Thermiva, our Tempsure, or a couple of devices that can be combined with sculpture to even get some of that elasticity issue, especially like maybe our ladies who've been, had pregnancy and sometimes skin elasticity can be a problem. We can certainly sometimes look at that as well. So those type patients, we just have to bring them in, kind of look at them, kind of give them an idea of what we're thinking. I mean, you're really going to kind of fall into the category, is this surgical only? Can we help it? Or do we actually probably need to concentrate more on just getting our nutrition and exercise in check for 6 months and coming back? Those are typically kind of where we position those patients. I mean, there's certainly some patients, unfortunately, it's just a surgical thing. Somebody goes and loses 150 pounds. To be honest with you, probably they're going to need to get a tummy tuck if they want to fix it. So we by no means try to act like sculpture fixes everything. The one negative of sculpture is that it's for a specific type of patient.
Yeah, and so the FDA and other ethical reasons, you have to be very general in your discussion here, because you just want to make sure that these conversations are educating people and not really diagnosing, in the live streaming while diagnosing. But
yeah,
there are other things that this could complement in a process, is what I'm seeing, and that you're not approaching with just one thing that's one silver bullet that's going to fix everything.
Most of our sculpture consults are current customers. They're current customers that have gone on a journey with us, and they've gotten to the point to where they feel like they've kind of maxed everything out, and this is just a problem area that they just can't get rid of. And I use it not only because I own it, but because I'm that kind of a person. There's just certain parts of my body that and I will admit I'm a little bit vain. I want those areas to look a little bit better. I feel like I deserve that. I feel like I work hard enough on my diet and exercise to get that. But our bodies, as we get a little bit older, they can fight us a little bit. And so luckily we have some of these technologies. It's just another tool in the toolbox, as you'll hear me say a lot. We've already covered a lot of the tools: nutrition, exercise, ketone esters, supplements, hormones, peptides. All tools in our toolbox. We don't have a toolbox that only has a hammer in it. We've got lots of different things, and that's what we're trying to do with our patients.
Well, I think one of the advantages with you, Dr. Kris, is that you're like one of us, that you're using these things, you understand what you're talking about, you've exposed yourself, so it's not like you're prescribing or directing us onto something that you haven't done yourself.
I pretty much have used everything in my office except for I have not done vaginal rejuvenation. So, I will not claim that one, but everything else I believe in my office I have done. And so I actually just was talking to a physician last night about peptides, actually, and he called me and we had a good about 30-minute conversation. And I basically said, if you haven't tried it yourself, you can't really help someone else with it. You have to try these different things and know how they work, know what kind of side effects can occur, so that you can explain it to patients better.
So on that last point there, I'm curious of what peptides some physicians might consider when people are experiencing allergies.
Thymosin alpha-1 would be the one that I would tell patients that, with allergies, that's a no-brainer. We really should already be on it, but, prophylactically, in my opinion, to help modulate the immune system, and so when you do get allergies or viral illnesses or bacterial illnesses, we might, your provider might consider increasing that amount some to just get a little bit more immune modulation. But I've known a lot of patients do quite well with actually using thymosin alpha-1 for their allergy issues.
All right. Well, this has been a great conversation, Dr. Kris. I've learned a lot today, and I guess we're going to have another conversation in a week.
Yes, sir. That's the plan.
All right. We're going to keep attacking the COVID-15 like the freshman 15 on the next couple of episodes. So everyone stay tuned. This has been Peptides and Age Management with Dr. Kris of the Research Clinic. You guys can reach out to the Research Clinic websites on the screen here, theresearchclinic.com. And if you're not in the area, then Dr. Kris can help you get connected with someone, hopefully in your area, that can help you learn and take advantage of some of these therapies we discuss. Any last words, Dr. Kris?
Nope, just it's supposed to be a beautiful weekend in Texas, so go enjoy it. Get out and be active.
All right. Well, that's a wrap, and we'll see you next week. Thanks for joining the Dr. Kris Podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast.